Congressman, that floored me. I knew that there were a lot of upfront costs. I didn't know that they were paying for stuff that would be years down the road.
Well, that's exactly right, Neil. What we would have called this in the private sector, and we did a few years ago, we called this Enron accounting, where you get 10 years of revenue and only 6 or 7 years of where the program is absolutely, or where the program is going to be in place. How else can Senator Baucus come out and say this is going to help the deficit? He does it by having 10 years of revenue and only 7 years of expenditures. It's absolutely outrageous.
Well, I think the debate could be even simpler than that for Nimrods like myself to understand. It would be like if you had a contractor come to your house and say, I want all the money up front, and I'll get around to your basement when I feel like it. No one in their right mind would do that. And maybe you put a third up. Some people put half up, but the whole kit and caboodle up. And for years. So let's say you assume that basement's going to be done. They won't even begin working on it for a few years. That's pretty bold.
Yeah, but remember what they want, Neil, is they want to pass this program so that they can get control of 18% of the economy. This is not about good quality health care. This is about certain parts of Washington wanting to get control of 18% of our economy so they can say who's going to pay it in, and then they can distribute it out. The rest of the bill is really legalized Washington corruption, where you throw in, a little bit of pork for Harry Reid so he can get reelected. Just throw something in for the residents of New York State so that Chuck Schumer can be happy. You throw in another $5 to $10 billion for the UAW workers in their retirement
plan. But Congressman, people they got to see through this, right? I mean, when push comes to shove, they're going to realize that when these taxes go up, they're not just going up for the 250,000 and over crowd. If you've got a generous health care policy, or deemed generous by the health care police, I guess, you're going to pay taxes on that. Your boss will, and you will as a result. And that affects people, many of them union workers, by the way, many of them against this particular provision, I might point out, but it's going to happen. So people well under 250,000 are going to start paying higher taxes. You can't tell me they're going to wake up and say, wait a minute.
Yeah, I think you're absolutely right again, Neil. You put this together, the legalized Washington corruption, the Enron accounting, and then what your previous guest was talking about. Most members of Congress, we won't even have a chance to look at the bill. What we need to hope and pray for is that what we're going to see over the coming weeks is what we saw in August, that the Tea Party folks in grassroots America are going to rise up and say, stop. We don't want this massive transfer of power from us to unaccountable and unelected bureaucrats in Washington.
Well, they might feel that way,
we need the Tea Party movement to come back.
Right, but they might feel this way. But I think these guys, the leaders, are just, the train has left the station, and it doesn't have brakes. You know what I mean? They are just ramming it forward.
I hope this is one case where you're wrong, Neil. I really do believe that if grassroots America and the Tea Party movement gets going, I think one of the last times I was on with you was just before the Tea Party movement in a rally in Washington, D.C. They came out in strength. They've got to start doing it, and they've got to keep doing it until this thing is done. And by I mean done, that we get real reform, not a Washington takeover of health care. I've got a lot of faith in the Tea Party movement. I've got a lot of faith in grassroots America that they are going to stand up, and as they see more and more of this bill, they're going to stand up and say, absolutely not.
We shall see, Congressman. It's always fun.
We shall see, yeah.
All right, thank you very much. All right, so we know